My name is Chris Fox. I'm the Executive Director of Voices for Non-Opioid Choices, which is a Washington, D.C.-based coalition dedicated to advancing federal policy solutions that can prevent opioid addiction before it starts. At Voices, we're proud to champion the No Pain Act. No Pain Act stands for Non-Opioids Prevent Addiction in the Nation, and it presents a real opportunity for us to prevent opioid addiction for the millions of Americans that go on to long-term opioid use following an acute pain incident. I'm hoping that you'll visit our website, www.nonopioidchoices.org, go to our action center, and write to your member of Congress.
Welcome to Prevention Resources' 17th Annual Fall Professional Conference. We are honored to have Leslie Gable and Peggy Dowd present on the Non-Opioid Choice Project. Before we introduce our speaker, here are a few housekeeping items. There will be a live Q&A at the end of this pre-recorded presentation, so please put all questions in the Q&A section. If you need technical assistance, please put your questions in the chat. A copy of the PowerPoint is located in the link below, as well as in the session materials section on the platform. Please be sure to fill out the survey at the end of the presentation. A link is at the bottom of this session page. All presentations will be recorded, and you'll have an opportunity to see all presentations and receive at a later date additional CEUs if needed. If you do require CEUs, please fill out the required information on the bottom of the survey for each presentation you attend. Peggy Dowd serves as Program Director for One Voice, a faith-based coalition located in Hunterdon County. In 2018, One Voice of Hunterdon Incorporated was awarded the Federal Drug-Free Communities Grant, and Peggy is responsible for the management and implementation of that DFC grant. She uses her experience with the Strategic Prevention Framework model in leading the coalition. Leslie Gable is currently the Co-Executive Director, Chief Executive Officer at Prevention Resources and has been with the agency since 2009. Leslie graduated with a marketing degree from Hofstra University in 1988. She has had over 20 years' experience in key corporate leadership roles in quality management and training with a focus on statistical analysis, auditing, and process improvements. Please welcome this session's speakers, Leslie Gable and Peggy Dowd.
Hello, my name is Leslie Gable, along with Peggy Dowd from the Safe Communities Coalition and the Drug-Free Task Force. We have the honor of representing our coalitions for the Non-Opioid Choice Project for managing acute pain. We've long figured out that if we could get our community not to want or to need opioids, we could truly solve the opiate crisis. We believe alternatives is the answer. The Hunterdon County Safe Communities Coalition and the Drug-Free Task Force is located in Hunterdon County, New Jersey, which is approximately an hour from New York City and an hour from Philadelphia. Our coalition's works really has expanded starting in 2009, with focusing to reduce underage drinking, marijuana, prescription drugs, and opioids through widespread collaboration and environmental strategies. The state of New Jersey, including Hunterdon County, is in the crisis due to opioids. The volume of purity of heroin and fentanyl and pill trafficking is significant. Fentanyl forensic lab submissions increased 642% from 2015 to 2018, while fentanyl-related classine bags increased by over 1,052%, according to the New Jersey Monitoring Initiative report from 2019. In New Jersey, from 2016 to 2020, over 14,000 lives were lost due to opioids, primarily due to fentanyl. From January 1st this year through June 30th this year, we have lost over 1,626 suspected overdose deaths, and over 1,772,000 opioid prescriptions have already been dispensed. On average, naloxone, also known as Narcan, was administered 41 times a day in New Jersey. That's more than over 15,000 administrations in 2019 alone. Most people from New Jersey know that Hunterdon County is a mix of suburban and rural pockets that's geographically isolated. However, residents have no problem getting access to prescription drugs. For example, 97% of our community have access to health insurance. Between 2019 and 2020, 85,027 opioid prescriptions were dispensed in this county alone, for a population of over 123,000 people. Additionally, cost is not a factor. Our median income is $155,000, and locally, the cost for a classine bag of heroin ranges from $3 to $5. Our coalition has been working to reduce access and increasing the education on the dangers and addictive nature of opioids back since 2009. In working with our data and our key informant groups, we knew we needed to find an additional unique approach as opioid deaths continue to rise in New Jersey. This project would bring a renewed focus, increased capacity, and a guidance from the expertise in our community. Even though our medical community have been working greatly to reduce the number of opioid prescriptions, we needed to explore and take on the challenging approach of addressing a local condition that has not been explored, which is the low cost and demand for prescription opioids versus alternatives.
Our problem statement was determined in the Non-Opioid Choices initial training in February 2020 at the CACA conference, which is the Community Anti-Drug Coalitions of America. While determining our root causes and local conditions, we realized that over the last 10 years, we had done very much work around reducing access and availability of prescription drugs in terms of safe storage and disposal, and also collaboration with the DEA on National Take-Back Days. But one area that had not yet been explored by our coalition was price and promotion, and how the cost of alternatives was a barrier to access. Knowing that successful coalition work is always based on outcomes, our first strategy was to establish baseline data. We added specific non-opioid usage questions to the PRIDE student survey, such as, in the past year, how often have you used chiropractic care, acupuncture, physical therapy, over-the-counter non-opioid pain medications, heat, and ice? And this data was initially collected in June of 2020, showing that most alternative therapies, with the exception of heat and ice, were rarely used. Our second point of data collection was established through a community knowledge survey. Baseline data shows us that 63% of people in our county had healthcare providers discuss alternatives with them. Local follow-up data showed us that while the majority are aware and interested in non-opioid alternative therapies, most insurance companies do not cover these therapies, and people are not willing to pay out of pocket. In addition, insurance companies often limit the number of sessions for therapies such as physical therapy or chiropractic care. And the bottom line perception is that alternative therapy is cost prohibitive.
When we started our projects in February of 2020, we never anticipated the pandemic and all the turns the virus took. New Jersey was one of the first epicenters of the COVID outbreaks in the country. This halted the progression of our project as our key stakeholders, the medical community, as well as insurance companies, were focused on battling COVID, and rightly so. We shifted our strategies at the time to build community readiness by raising awareness of the Non-Opiate Choice Project and educated on our community on the fact that non-opiate choices saves lives. Our radio spot reached over 500,000 people, and print reached over 68,000, which is more than half in the county we live in. On the programming side, our Health Outlooks program focused on natural relaxation techniques as a way to manage chronic pain. Our coalition strategies had to quickly shift to online engagement. We quickly created the Safe at Home Challenge to address the dangers of medicines stored within the home. Knowing our community really responds well to animals, we partnered with the prosecutor's office, 911 public safety office, and our K9 unit to create public safety announcements to introduce the hashtag Safe at Home Challenge, posting pictures resulting in an increase of 82% of social media engagement.
Hello, this is Acting Hunterdon County Prosecutor Mike Williams. Today we want to provide you some important tips regarding drug safety in your home as we continue to shelter in place. In partnership with Prevention Resources, the Safe Communities Coalition, and your law enforcement agencies, we're committed to preserving the quality of life in Hunterdon County. Please continue to exercise proper social distancing and avoid unnecessary travel beyond your home. A safe community starts with you in your home.
My name is Karen DeMarco. I'm the health officer with the Hunterdon County Department of Health. In response to the COVID-19 public health emergency, we urge residents to stay home as much as possible to reduce the spread of illness within our community. We encourage you to take steps to ensure safety in your home during this time, and that includes securing medications. Organize and separate your current and necessary over-the-counter medications from your prescription medications. Secure and lock all of your current prescription medications in a safe space. We also urge residents to stay up to date on the latest information regarding COVID-19. You can visit our health department website to not only get national information, but also what's happening locally. Thank you.
Hi, this is K-9 Polis, and I'm Sergeant Ferrer of the Reddington Township Police Department. This is a Safe at Home challenge. Safe medication practices for your pets are essential. Safe use: assign one person to dispense medicine accordingly to your pet. Do not allow anyone else to dispense the medicine. Make sure they are of age. Safe storage: make sure all medicine is in a locked container out of reach of all minors. Safe disposal: make sure all unused medicine is placed inside coffee grinds or kitty litter, inside of a black bag, and properly disposed of. After the COVID-19 restrictions are lifted, you can get rid of your medicine at the local police department at the drug drop box.
Online education continued to be very critical during the pandemic. Through our Teen Safety Nights, we partnered with the DEA and the high school. We were able to address over 950 attendees, increasing their knowledge on opioids by 96%. We held virtual town halls to showcase our Fentanyl Factor documentary, which tells local stories from a loved one's perspective of the deadly consequences of fentanyl. Increasing knowledge and connecting our community to resources continues to be a critical aspect of our work to reduce opioid overdose deaths. The Fentanyl Factor documentary is located on our website.
Now here's a short clip from the Fentanyl Factor.
Fentanyl is a Schedule II narcotic.
Fentanyl is a very dangerous drug.
Fentanyl is lethal.
We're finding it in more than half of all the heroin in our county.
What's on the streets today is not what has been there in the past.
Fentanyl can basically be in any drug.
Many people have accidentally died of an overdose.
The reason for that is fentanyl. You don't know what you're going to get.
By the time you're done watching this film, someone will have died of an overdose.
I think about him every day. He was my best friend. He was an awesome guy. You know, he looked out for everyone. He wasn't even doing heroin or anything, and he received a batch of cocaine that was laced with fentanyl.
We have had overdoses where we thought it was cocaine, and it wasn't cocaine, it was fentanyl.
His brother went to check on him and found him unresponsive, covered in vomit. By the time he was in the hospital, he was brain dead. So his mother made the decision to pull the plug. An hour later, we're never going to let his memory die. You know, that's our boy.
If you're buying heroin, you don't know if fentanyl's in it. If you're buying cocaine, you don't know if fentanyl's in it. If you're buying Xanax, you're taking pills, you don't know if fentanyl's in it.
Fentanyl is approximately 100 times stronger than morphine. The amount that can kill you is an amount that you cannot even see. It's a couple little grains.
It is an absolute game changer now with fentanyl. I'm a part of the K-9 unit. I have a Dutch Shepherd, his name is Jax. So I come in contact with narcotics a lot. It's my primary job. On this night, I ended up searching a motor vehicle and came across what we believed to be was fentanyl. I started feeling very dizzy and my face was very red, tingly. That's never happened before. I've searched hundreds and hundreds of cars.
The drug can enter the body in any number of ways. Unless you're using the proper equipment, either gloves or a mask or a lab coat, you could transmit a lethal dose into your body without even knowing it.
I'm a trained first responder. If it could happen to me, not even touching it, it could happen to anybody.
I want to be very clear. A person that ingests something that they got from a friend, that they got off the street, they got from their neighbor, they don't know what it is that they're putting into their system.
If you think you're getting a Xanax from your buddy, it's not. It's fentanyl, and it's going to kill you.
An individual under peer pressure may do drugs one time, and that'll be a lethal dose of fentanyl. It's that one time.
Certain kids think that they could just try something one time, but half of the time they don't know what they're ingesting. It could be fake pills, it could be fake anything, and it could be laced with fentanyl, and then that one time could be it.
If your child is involved in drug use, I would be concerned. It is life and death.
I've overdosed 5 times. I just am tired of the same cycle, the same waking up in the ambulance, spending all my money to the dealer. I was just tired of that, and I was tired of seeing the look on my parents' face every time they would come and see me in the hospital bed. I believe I can beat this. I want to live. I want to experience all the things that my father told me I could experience that is available in life. I want to meet somebody, fall in love, hopefully, have a family someday, have a nice paying job, have all the things that my father gave me. A lot of people want just to see me alive and healthy and sober.
Every person that is dying is someone's child.
People think that it's never going to happen to their child, their brother.
The disease of addiction doesn't discriminate. It'll get you. It'll get anyone. It doesn't matter who you are or what you're doing. Eventually, you're going to realize that you're in a hole and it's going to be too late and you're going to be addicted.
We're in the middle of an epidemic. We need to do something different. Something has to change.
Ensuring our Latino population had access to home medicine disposal instructions, we ran a town hall meeting entirely in Spanish. During the pandemic, we also focused on creating educational materials and heightened our outreach to the older adults on managing pain through alternatives. We created safety bags that were distributed to senior citizens at their homes, which contained alternative pain management techniques. As part of the CADCA training for the Non-Opioid Choices Project, we heard from a mother, Carrie Rhodes in Virginia, who lost her son Taylor, who was a school athlete, to an opioid overdose. This story really resonated with our coalition because of the similar demographics to Hunterdon County. We reached out to Carrie Rhodes and we held a town hall meeting, shared Taylor's story, and included a panel discussion with Carrie, our local athletic director, our prosecutor, and chief of detectives. And this program was aimed at athletes and their parents. When we delved into the actual cost analysis of the non-opioid alternative versus opioids, we were very surprised to uncover that our community's perception of alternatives as cost prohibitive was actually the exact opposite. As we share our infographic and our video, you will see the cost savings of alternative therapies are actually significant.
Hi, my name is Leslie Gable of the Safe Communities Coalition here in Hunterdon County, New Jersey. We work collaboratively within our community to reduce substance use.
Hi, my name is Peggy Dowd and I'm the project coordinator for the Safe Communities Coalition of Hunterdon County. For over 10 years, the Safe Communities Coalition has been working to reduce prescription drug use among our youth and community members. We have been working specifically on reducing access and availability to prescription drugs and opioids, as well as increasing the risk and perception of harm of opioids.
Unfortunately, overdose deaths due to opioids are increasing across the United States. In New Jersey, from 2018 to 2020, we lost over 9,000 lives due to an opiate overdose. Locally here in Hunterdon County, from 2019 to 2020, we've experienced a 46% increase in opiate overdose deaths.
In the last year, we've been working on a project called the Non-Opioid Choices Project, and this is a great opportunity for our community to explore alternatives to opioids.
Looking at the non-pharmacologics and how we can work with insurance carriers to make sure that they are covered.
Our research has indicated there's significant benefits from insuring opiate alternatives, which would not only benefit the patient, but also reduce the significant risk to an opiate addiction. Unfortunately, many insurance providers either do not cover or limit their coverage for alternatives therapies. Some of these therapies are chiropractic care, acupuncture, massage therapy, just to mention a few. This is mainly due to cost, as a prescription pain pill is very inexpensive.
In working with insurance companies, one of our goals is to not only have them cover some of these alternatives to the opioids, but also not limit the number of sessions. For example, many people that we've spoken to have a limited number, maybe 10 a year, for chiropractic or physical therapy, and that's not always enough to get to the root cause of the pain. When used for 1 month, the likelihood that someone would still be taking that opioid 1 year later is almost 30%.
Looking at the cost savings between a year later of opioids, it's over $1,000, and a 3-month alternatives to some of the things you've been mentioning is about $600. So there's a big cost savings there for insurance providers.
The cost of overdose is significant. 53% of those that overdose are treated and admitted into a hospital at an average cost of $11,731.
Last year in New Jersey, there was over 14,600 Narcans administered by law enforcement as well as EMS. If you take that statistic of half of those Narcans that were deployed, that's over $82 million in hospital care for that patient, a significant cost that may have been averted with an alternative pain management. We are asking our insurance providers to help us in the fight of the opiate crisis that we are in by expanding coverage and removing limitations for alternative pain management. Our call to action is to bring together our entire community to address the opiate epidemic. For more information on our infographic and our call to action to expand coverage of alternatives to opioid, please visit thesafecoalition.org.
After all of these years of working on this, on opioid reduction, we're still just beginning. That's one of our lessons learned. When we spoke with Carrie Rose and we heard her son's story, it was really eye-opening to hear that years later, her daughter had the exact same surgery that her son had, where he was prescribed his first opioid that led to his addiction. And she had to fight for a non-opioid alternative. And it wasn't until she told her story about Taylor that they listened. So we're still, after all these years, learning that we have to do a lot of advocacy for these non-opioids. Also, we learned that our community is ready. Our feedback from a local chiropractor is that she does not even advertise. There's waiting times for massage and acupuncture treatments. And the cost savings of using non-opioids is so much more than we thought. And lives can be saved, which is really the best outcome ever. We also need to shift our mindset. Similar to understanding how seatbelts save lives, we require environmental change strategies with opioids.
Some of our next steps is to focus on sustainability. We'll expand our baseline data on different age brackets, starting with college-age students in relation to alternative pain management practices. Our research has shown that the key stakeholders with tremendous influence and engagement with insurance providers are large corporations, as they are their biggest customers. We'll be working with these CEOs and their leaderships to bring together the decision makers of the insurance providers to address the barriers to alternative care through demonstrating cost savings that we've been able to uncover. As part of our coalition's advocacy and to provide education on legislation that could help decrease overdoses, we want to take a moment to discuss the No Pain Act, which is short for the Non-Opioids Prevent Addiction in the Nation Act. This bipartisan legislation is designed to increase utilization of non-opioid pain management approaches by addressing outdated federal reimbursement policies. The bill would ensure safe, non-addictive therapies widely available to tens of millions of Americans who undergo outpatient surgical procedures every year. This policy change aims to reduce unnecessary exposure to opioids and the likelihood of opioid abuse or addiction following acute pain incident.
The images you see now are part of a new campaign for the non-opioid choices to educate the public on the No Pain Act, as well as inform our community on exactly what alternative therapies are available to them and how they target areas of the body and pain receptors in order to effectively reduce pain.
So we are very excited to be hosting this brand new show on our platform. And really the show is here to help educate and inform the public about the opioid epidemic, alternatives to opioids, and also educate the public on a new bill called the No Pain Act. And so we are working with Voices for Non-Opioid Choices to educate and advocate for healthy communities through these non-opioid choices. And so to help us understand the opioid epidemic a little bit more, and of course the No Pain Act, we have with us from Voices for Non-Opioid Choices, Chris Fox. So welcome so much to the podcast, Chris.
Thank you for having me. Happy to be here.
So I think for just all of our listeners and our viewers out there, a really great place to start is about the opioid epidemic. We've obviously heard about it in the news, but let's talk a little bit about like, what is it? Why is this a problem?
For sure. Well, to be very blunt, it's a problem because last year, 95,000 Americans died of a drug overdose. Of these, about 75% or 71,000 died of an opioid-related overdose. This marks a 30% increase in just 1 year's time and the biggest single-year increase in nearly 2 decades in the number of opioid-related overdose deaths. So like many other conditions, the COVID-19 pandemic has unfortunately had some repercussions and ramifications on public health in America, and perhaps most tellingly on the opioid addiction epidemic in this country. And unfortunately, despite a couple years of progress, in the middle of, say, 2018, 2019, we are unfortunately facing all-time highs, and we're breaking all the wrong kind of records. So now, more than ever, is the time that we need to be paying attention to what we're doing and doing what we can to prevent opioid addiction where we can.
Mm-hmm. And I mean, just in New Jersey, so last year in 2020, we had 3,046 people die of a suspected overdose just in New Jersey alone. And even this year, we're still seeing the ramifications of COVID. As of June 30th, we had 1,626 New Jersey residents who have died already. And so it's like and the hard part is so many of these lives are young people. But I think that's also something that's really interesting about the opioid epidemic is it's also old people who got a prescription, maybe an opioid from a surgery, and then they became addicted to that prescription that they were given. And already there have been 1,772,141 opioid prescriptions dispensed as of June 30th. That's enough prescription to give 1 out of every 5 New Jersey residents an opioid prescription. And that million is just New Jersey. And that's just like, it's a crazy stat to me. And I know that we don't talk that much about stats, but I think that you have to give it's like some sort of perception of just how much that is, how many that is. And so I think we just really need the alternatives in, this conversation.
Right. And I think one of the things too to talk about when you talk about those numbers of people that were just lost in New Jersey, or the 95,000 or 71,000 last year in the United States alone, what always comes back to me here is about 9/11. And we lost 3,000 people in 9/11, and everybody is so devastated for those folks. And we're losing the same number of people every year just in New Jersey alone, or so many across the entire nation. And, I know people, Chris, talk a lot about how it's a choice for people and, oh, they did this, but I don't think people realize with drug overdoses, especially opioid related, is that most of these folks, I think it's around 75%, correct me if I'm wrong, start out taking opioids from an injury. They hurt their back at work. They've gotten their wisdom teeth taken out. So most people who go on to use heroin have started by using prescription pain pills, correct?
Yeah, that's right. Federal government data says that 80% of heroin users have reported initiating their opioid use via prescription painkillers, whether those were prescribed for themselves or they have been diverted through the community via leftover pills that are found in medicine cabinets from too many opioid pills perhaps being prescribed after one of those surgeries that you mentioned, Erin.
And I think it's really important to say in the beginning of this conversation that opioids as a prescription to help manage pain after a surgery there is a time and a place for them. They exist for a reason, but there are also so many other alternatives that can help people with pain, especially, post-surgical pain. There are so many other options. And so that's why I'm really excited to have this conversation, because I think, a lot of times we hear, oh, somebody got their teeth taken out and they just, were given a few days worth of Percocet, or, oh, they had this small outpatient surgery and they were given, some other sort of opioid. And it's really cool to learn about how there are so many other treatments and therapies that people can have instead of an opioid, but also when somebody needs that, that's still available. And so that's kind of where we get into this No Pain Act. And Chris, you're kind of like the big expert on this act. Could you tell us a little bit more about that?
Of course. So first of all, the No Pain Act is an acronym. It stands for Non-Opioids Prevent Addiction in the Nation. And Paige, you've alluded to some of these statistics before, but there are millions of Americans that go on to long-term opioid use after a relatively routine surgery, whether that's wisdom teeth, shoulder, knee, hip. a surgery along those lines. In fact, it's about 3.75 million Americans initiate long-term opioid use following these surgeries. And the fact of the matter is that for many of these, that initial prescription starts them down a path towards addiction that can ultimately, Aaron, as we talked about earlier, end up with heroin use or fentanyl use or other synthetic forms of opioids. So it's a very, very dangerous path that we set people on potentially. Now, again, Paige, you're absolutely correct. There is a time and a place in the clinical use for these opioid pills, and neither I nor Voices is in any way, shape, or form anti-opioid pills per se. What we are, however, is we are pro-patient choice, and we are pro giving families and caregivers and doctors the choice in how they want to help manage patients' pain, particularly after an acute pain incident, whether that's a surgery, an accident, a trauma, a sports injury, or something along those lines. The simple fact is right now that they don't have that choice, and that we're making real medical decisions that have real repercussions and ramifications for patients, including but not limited to exposing patients to the opportunity potentially to develop an opioid use disorder. And that, for me, is unacceptable. What we need to be doing is we need to be making available options and choices for these patients and for these providers to help them manage pain in a way that they want to manage their pain and in the most responsible manner that we possibly can. And so what the No Pain Act would do, to be very clear, is it would provide these healthcare professionals with the opportunity to provide patients with non-opioid choices by removing the economic disincentives that currently exist to utilizing and prescribing opioid pills for acute pain patients.
Some frequently asked questions regarding the No Pain Act. The first question is, if enacted, how would the No Pain Act impact patient or provider access to prescription opioids? And this is a very common question, and we want to make it very clear that the No Pain Act does not do anything to limit patient or provider access to prescription opioids. It would not change anything about the way chronic pain is treated. So if a patient wants and needs an opioid prescription, there is nothing that would prohibit or limit this. The No Pain Act only adds choices to the non-alternatives, but does not take away the choice of opioids. Another question was, would this bill increase the costs for Medicare beneficiaries? And the answer is no. Historically, when the Centers for Medicare and Medicaid Services has implemented separate payment for other drugs and devices, the agency has not increased costs for beneficiaries. The last question is, what are the non-opioid approaches to pain management that would be made more accessible by the No Pain Act? The No Pain Act defines a non-opioid treatment as drugs, biologics, or medical devices that have demonstrated the ability to replace or reduce opioid consumption in a clinical trial or through clinical data published in a peer-reviewed journal. Additionally, the No Pain Act requires a report to Congress on limitations, gaps, barriers to access, or deficits in Medicare coverage or reimbursement for therapeutic services, such as acupuncture, chiropractic, physical therapy. We talked a lot about how currently those alternatives do have some limitations, which then inhibit people from seeking out that type of therapy.
We know that in order to truly address the opioid crisis, we have to do it in a collaborative way. And as you can see on the screen here, these are all our incredible partners that we have been working with and continue to work with that have truly started to make a difference, especially locally here within our community. It's going to take all of us working together, and everything that everyone can do, from keeping our medications safely stored to properly disposing medications, but also looking at ways that we can ensure alternatives are covered and people can get at these alternative therapies, whether they're non-pharmacologics or alternative therapies such as chiropractic care, massage therapy, and ensuring that those that are covered are not limited in those areas. Our call to action is to ensure that we have smart policies and choices that truly will help manage pain in ways that doesn't build addiction. We want to thank all our partners for the ongoing and dedicated work that they continue to do. So please help join us in ensuring that these policies and alternatives get covered. Thank you so much.
Thank you.